I'm joined now by Dr. Michael Freed, who is the director of the UNC Liver Center. Thank you so much for being here. I know you are doing the session on treating viral hepatitis. Giant topic. You're going to try to pare it down. Can you give us a bit of an overview?
Sure. The Hepatitis Debrief is meant to try to synthesize all the important clinical work that was done at this liver meeting. You can imagine it's quite a daunting task. Over 400 presentations were related to hepatitis C. And it's quite remarkable all the work that's going on that will ultimately benefit patients with new therapies and new ways to apply the current therapies.
It has been so exciting, I think, over the last year in that drug treatments were available where they really were not before. Can you talk to me about some of the advancements in treating patients?
Sure. Well, over the last few years, we've had treatments for hepatitis C for more than 20 years, but they involved medications that were very toxic. And the real change now, of course, has been where we're dealing mostly with all oral regimens. So patients with hepatitis C can be treated with one pill or several pills once or twice a day that can cure over 90% of patients with hepatitis C with very few side effects. These medications are applicable to most populations of patients with hepatitis C, including those with more advanced liver disease, patients with cirrhosis, patients who have undergone liver transplantation, and even those with HIV co-infection that in the past did not have a lot of good treatment options. So one of the things that we'll see in the Hepatitis Debrief is how these medications are being applied to all these different populations.
Certainly exciting for current patients. Are you talking to people about this concept of getting others to get tested as well? Because I think it's an easier message about testing when you say, we've got a good treatment for you.
Yes, and in the past I think there was some hesitancy about testing people because they felt that even if you identified hepatitis C, treatment options were somewhat limited. It's critically important to identify patients now. In the US, it's estimated that only about half the patients with hepatitis C have been adequately identified. So the CDC now recommends birth cohort testing, where anyone born between the years of 1945 and 1965 should be tested for hepatitis C. We hope to identify many more patients with this disease, counsel them appropriately, and then link them with the appropriate care so that they could potentially get treated with these new agents.
Any other cutting-edge therapies or
any
absolutely. New focus that you can give us a little hint about?
So there's also, even beyond the currently available regimens, there are a number of very exciting trials that are being reported at this meeting that are in phase 2 that look at shortening duration of treatment, also applying the medications to different populations. So I think the Hepatitis Debrief will give a nice overview of what went on at this liver meeting with some important take-home messages.
And it's so wonderful to be able to give some positive reporting.
Oh, absolutely, yeah. It's a very, very hopeful message for all our patients now.
Thank you so much, Doctor.
You're welcome.